Your nails are changing. Maybe you noticed it months ago. A ridge that wasn't there before, a color that doesn't quite look right, a shape that's slowly curving in a way you can't explain. And you probably told yourself what most people over 60 tell themselves, it's just aging. It's just what nails do. It isn't. What's showing up on the surface of your nails right now may be one of the most precise diagnostic windows your body has. And for 4 specific diseases that are entirely capable of going undetected for years, your nails are not aging. They are warning you. The difference between those 2 things is the difference between catching something early and discovering it too late. I need you to watch this entire video, because what I'm going to show you is not a list. It's a map of what your body has been trying to tell you and exactly what to do with that information starting today. My name is Dr. Elena Marsh. I've spent more than 20 years in clinical neurology, and in that time I've sat across from patients who came in for something routine, a follow-up, a referral, a second opinion, and left with a diagnosis that changed their lives. Not because something happened suddenly, because something had been visible for months, sometimes years, that no one had taken the time to look at carefully. One of the things I look at, always, are the nails. This is not alternative medicine. This is clinical medicine taught in every serious neurology and internal medicine program in the world and consistently validated in peer-reviewed research. A landmark review published in the American Journal of Clinical Dermatology identified nail changes as reliable early indicators of systemic disease across cardiovascular, neurological, renal, and autoimmune categories. Diseases that together account for the majority of serious health events in adults over 60. The problem isn't that the science doesn't exist. The problem is that a 10-minute appointment leaves no time to look at your nails and explain what they mean. That's what this video is for. Before we go further, quick question for you right now. When was the last time you actually looked at your nails? Not to trim them, not to clean them, but to look at them. Type yes in the comments if you've noticed any changes in the past year. Type no if your nails look exactly the same as they always have. I read every single comment, and your answer matters more than you think. Now, let's begin with what's actually happening beneath the surface of your nail. Because to understand why nails reveal what they reveal, you need to understand what a nail actually is. Your nail is not dead tissue sitting on top of your finger. It is a living, vascularized structure fed by a dense network of capillaries, tiny blood vessels that carry oxygen, nutrients, and everything else your circulatory system delivers. The nail matrix, which is the tissue just beneath the base of your nail, is one of the most metabolically active regions in your peripheral anatomy. It responds, visibly, measurably, to changes in blood oxygen levels, protein availability, circulation pressure, and inflammatory markers circulating in your bloodstream. This means that when something goes wrong systemically, when your heart is under strain, when your kidneys are struggling to filter waste, when your nervous system is losing its grip on peripheral circulation, when your immune system is attacking tissue it shouldn't, the evidence shows up here. On the surface you can see. In the tissue, most people glance at and dismiss. What you're looking for are not dramatic changes. You're looking for the quiet ones, the ones that developed so gradually you stopped noticing them. That's exactly where the 4 diseases hide. Let's talk about the 4 diseases and the specific nail signs that belong to each one. Not vague descriptions, precise clinical presentations, the kind your doctor would recognize immediately if they had the time to look. The first disease is cardiovascular disease, specifically chronic heart failure and arterial insufficiency. The nail sign to look for is called clubbing. This is a gradual rounding and enlargement of the fingertip, where the nail curves downward over the tip of the finger like the back of a spoon turned upside down. It doesn't happen overnight. It develops over months or years, which is exactly why most people don't notice it until the change is significant. What's driving it is a reduction in peripheral oxygen delivery. when your heart is struggling to pump efficiently, or when your arteries are narrowed enough to restrict blood flow to the extremities. The tissue at the tip of your fingers responds by proliferating, growing, thickening. It's your body attempting to compensate for oxygen it isn't receiving in adequate supply. A study published in the New England Journal of Medicine found that clubbing was present in a measurable percentage of patients with chronic cardiac and pulmonary conditions who had not yet been formally diagnosed, meaning the nail was showing the disease before the chest showed it, before the symptoms became undeniable, before the event. Look at your fingertips right now. Press your two thumbnails together, nail to nail. You should see a small diamond-shaped gap between them where they meet. That gap is called the Schamroth window. If that gap is absent, if your nails press flush together with no space between them, that is a clinical indicator of clubbing. That is the shape of a cardiovascular warning you may have been carrying for months without knowing it. The second disease is chronic kidney disease. The nail sign here is called half and half nails, also known clinically as Lindsay's nails. The lower half of the nail, closest to the cuticle, appears white or pale. The upper half, toward the tip, is darker, brown, pink, or reddish. The line between them is sharp, distinct. Your kidneys are responsible for filtering waste from your bloodstream, including urea, creatinine, and a range of metabolic byproducts that accumulate when filtration slows. When kidney function begins to decline, those compounds don't disappear. They deposit in tissue, in vessels, in the capillary bed beneath your nail matrix. The discoloration you see is not cosmetic. It is the visible record of what your blood is carrying that your kidneys are no longer fully clearing. Research published in the Journal of the American Academy of Dermatology found half and half nails present in approximately 40% of patients with chronic kidney disease, many of whom had no other presenting symptoms at the time of diagnosis. 40%. That is not a rare finding. That is a common one that goes unexamined because no one thinks to look at the nails. The third disease is type 2 diabetes and insulin resistance. The nail sign is yellow nail syndrome combined with thickening and slow growth. Nails that have taken on a yellowish hue, not from nail polish, not from age, and that seem to grow more slowly than they used to, with a texture that is thicker, more brittle, and harder to trim cleanly. What's happening is a process called glycation, the binding of excess glucose molecules to the proteins that make up your nail structure. When blood sugar is chronically elevated, glucose attaches to collagen and keratin, the structural proteins in your nails, and alters their composition. The nail grows more slowly. It becomes discolored. Its texture changes. This is the same process happening in your blood vessels, your kidneys, your nerves, but in the nail, you can see it. Here is exactly what I want you to do, starting today. What I'm about to give you is called the Nail Signal Protocol, a 5-step daily practice built directly around the 4 biological mechanisms we just covered: peripheral circulation, kidney filtration, blood glucose regulation, nerve signal integrity. Each step targets one of these systems, and several of them target more than one simultaneously. This costs nothing. It requires no equipment. It can begin tonight. And if you do it consistently for 30 days, the research suggests your body will show you the difference, not just in how you feel, but in what your nails begin to reflect. Let's go through each step precisely. Step 1. The cold-warm water alternation every morning, 3 minutes, before coffee, before breakfast, before anything else. Run cold water over your hands and forearms for 30 seconds. Then warm water for 30 seconds. Alternate 3 times, finishing on cold. What this does, it creates what physiologists call vasomotor cycling, a rhythmic contraction and dilation of the peripheral blood vessels in your hands and forearms. Cold causes vasoconstriction, warm causes vasodilation. Alternating between them trains the smooth muscle tissue in your vessel walls to respond more efficiently, improving the capillary circulation that feeds your nail matrix directly. In patients with early-stage arterial insufficiency, the cardiovascular condition behind clubbing, diminished vasomotor response is one of the first measurable signs of decline. This single step, performed daily, exercises that response the same way you would exercise a muscle. It doesn't reverse damage that's already done, but it slows the progression of what hasn't yet become irreversible. 3 minutes, every morning, before anything else. Step 2, the deliberate hydration window. 8 ounces of water within 10 minutes of waking. Not coffee, not juice. Water. Here's why this matters more than most people understand. Overnight, your blood becomes measurably more viscous. You've gone 7 or 8 hours without fluid intake, while your kidneys continued filtering, your cells continued metabolizing, and your body continued losing moisture through respiration. By the time you wake up, your blood is thicker, and thicker blood moves more slowly through the capillary networks that supply peripheral tissue, including the nail matrix. For anyone with early kidney compromise, the condition behind Lindsay's nails, this morning, viscosity is not a minor inconvenience. It is a concentrated window of stress on an already strained filtration system. The kidneys work hardest in those first hours after waking. Delivering water immediately reduces that burden. 8 ounces within 10 minutes of waking every single day. A study published in the Clinical Journal of the American Society of Nephrology found that consistent morning hydration in adults over 60 was associated with measurable improvements in glomerular filtration rate, the primary clinical measure of kidney function, over a 12-week period. That is your filtration system responding to something as simple and free as when you drink your first glass of water. Step 3. The post-meal walk. 10 minutes of walking within 30 minutes of finishing any meal, every meal. Not exercise, not a workout, a walk. Slow, steady, 10 minutes. When you eat, your blood glucose rises. In healthy metabolic function, insulin responds quickly, moving glucose into cells for energy. But in adults over 60, particularly those with any degree of insulin resistance, that response is slower. Glucose stays elevated in the bloodstream longer, and every minute of sustained elevation is another minute of glycation occurring in your peripheral tissue, your vessels, and the keratin matrix of your nails. Walking immediately after eating activates glucose uptake in your skeletal muscles through a mechanism that is partially independent of insulin, meaning your muscles begin pulling glucose from the bloodstream using their own contraction-driven pathway, without waiting for the insulin response to catch up. This is not a supplement. It is a physiological mechanism built into your body that most people over 60 have never been told to deliberately activate. 10 minutes. After every meal, the timing is the protocol. Step 4. The nightly peripheral nerve reset. 5 minutes before sleep, no equipment required. Sit on the edge of your bed, remove your socks. Spend 5 minutes performing slow, deliberate toe and foot rotations, rotating each ankle in full circles, flexing and extending your toes, pressing your feet flat against the floor and lifting your heels, then pressing your heels down and lifting your toes. This targets the peripheral nerve pathways that supply your lower extremities, the same pathways that begin to lose signal integrity in early peripheral neuropathy, the condition behind Beau's lines. Peripheral nerves maintain their function through regular mechanical stimulation and circulation. When we sit for long periods, as most adults over 60 do, those nerves receive neither. The signal weakens. The nail matrix records it. 5 minutes of deliberate peripheral movement before sleep restores circulation to the nerve pathways at the exact point in the day when your body enters its primary repair cycle. You are giving your nervous system the signal it needs at the moment it is most capable of using it. 5 minutes, every night, before you lie down. Step 5. The monthly nail audit. Once a month, good lighting, 3 minutes. On the first of every month, examine your nails under good natural or artificial light. You are looking for 4 specific things. And now, you know exactly what they are. Check for the Schamroth window test. Press your thumbnails together and confirm the diamond gap is present. Check for any half and half coloration, pale at the base, darker toward the tip. Check for yellowing or unusual thickening that isn't explained by trauma or nail polish. Check for horizontal ridges, Beau's lines, running across the surface of any nail. If you find any of these, you are not panicking. You are bringing a specific, informed observation into your next medical appointment. You are walking in with language, with a clinical name, with a request for a specific test. That changes what happens in that appointment entirely. Document what you see. Take a photograph if it helps. Date it. Compare it the following month. Your nails change slowly, and that means tracking them over time gives you information that a single snapshot never could. This is not self-diagnosis. This is self-literacy. The difference is enormous, and it may be the most important 5 steps you take this year. You came into this video glancing at your nails the way you have your entire life without knowing what you were looking at. You're leaving with 4 clinical names, 4 biological mechanisms, and a 5-step protocol you can begin tonight. That information existed before this video. The research existed. The nail signs existed. Your body may have been displaying them for months. What changed today is that you now have the language to see them. There is someone in your life, a spouse, a sibling, a parent, a friend, who is over 60 and has never once thought to look at their nails this way. They have never heard of the Schamroth window test. They don't know what Lindsay's nails look like. They don't know that a horizontal ridge across their fingernail has a clinical name and a biological explanation. This video can reach them before the morning it matters most. Share it with them today, not for this channel. Because the 20 minutes they spend watching this may be the 20 minutes that changes what happens at their next appointment, or whether they make that appointment at all. If you haven't subscribed yet, please do that now. Every week, I bring research-based, clinically grounded information about what your body needs after 60. The information I wish every patient had before they ended up sitting across from me. Subscribe so you don't miss what's coming next. Everything I've shared today is based on published research and more than 2 decades of clinical experience in neurology. It is not a substitute for your personal medical care. The nail signs I've described are indicators, not diagnoses. They are the beginning of a conversation with your doctor, not the end of one. Before making any changes to your medications, your diet, or your daily routine, please speak with your own physician first. They know your history. Bring what you've learned here into that conversation. Write down the names, describe what you've observed, ask for the specific tests. That is exactly where good medicine begins. With an informed patient who knows what questions to ask. That patient is you now.